meet. And today we have one presenter, but before I introduce him, I'd like to say that this week we are celebrating the Patient Safety Week. So we'll be having a series of webinars related to safety, patient safety, and staff safety. And today we're going to have an interesting topic about the health worker safety. The series started yesterday. Yesterday we talked about medication safety. Unfortunately, tomorrow we'll take a bit of a break. We'll talk about forensic in medical legal issues, but it's still somehow related to safety. But we'll take a break to go back to complete the medical legal symposium. I hope you can all hear me. I can see somebody saying they can't hear. Let me know if you can hear me. Okay.
Dr. We can.
Oh, fantastic. So I'd like to introduce our speaker today. It's called Mr. Joseph Wakaba. He works in Kenyatta National Hospital, Public Health Department. And I'll let him tell us more about himself as he starts us off in this session. So remember to put your questions in the Q&A section, and we'll be able to address them at the end of the session. Karibu, Mr. Wakaba.
Thank you, Dr. As Dr. has said, my name is Joseph Wakaba. I work at Kenyatta National Hospital, Department of Public Health. So today I'll just be taking you through workers. Let me find the presentation. Health worker safety, yes. So I'll just take us to the first slide. Yes, so basically about health worker safety, I can say that the title is somewhat the same as occupational safety and health. You can use them interchangeably. So on this presentation, we will look into the introduction of occupational safety and health, definitions, a little bit of the concept of occupational safety and health, the aim, principles, a little bit of occupational diseases, and finally on the legislation surrounding occupational safety and health. So yeah, for the objectives is basically to understand the concept of occupational safety and health, recognize the different occupational hazards around the workplace, and essentially to prevent, or rather to know the prevention and control of the hazards, and to know the occupational diseases that someone can have due to exposure to hazards. So we'll start with the definitions. In short, occupational safety and health is basically the science to recognize, the science to evaluate and control. And control hazards arising from workplace, which have an implication on the workers' health and their well-being. A hazard is anything at your workplace that can cause harm or injury. And risk is the odd of an hazard causing harm. Safety is hard to define, but the ideal definition of safety is the state of being safe from harm. Health is the mere absence of a disease or an infirmity. It includes the physical and mental elements affecting health, which are directly related to safety and hygiene at workplace. And lastly, occupational disease is any type of disease that can be contracted after an exposure over a period of time to risk factors, which we will kind of look into them as the presentation goes, which arises from any work activity. So to bring you to speed, we need to understand why occupational safety and health is kind of important. According to International Labour Organization, about 2.3 million work-related deaths occur annually, which is equivalent to about 6,300 deaths every single day. So this statement alone can kind of show us that occupational hazards and risks at workplace can lead to death. And the number of deaths is so high, you can even compare it to other diseases that are not occupational. About 340 million occupational hazards occur annually. Accidents occur annually. So these are accidents that can either lead to death or can either lead to, let's say, an injury of which somebody will heal from. But still, the data shows that cumulatively is 340 million. About 160 million victims of work-related illnesses occur annually. And coming down to the healthcare sector, about 59 million workers are exposed daily to the variety of hazards in the workplace. That means in the hospital setting. According to WHO, the burden of disease from sharp injuries, the needle prick injuries that occur around the hospital is 37% of 37% of hepatitis B are due to sharp injuries at workplace. And we all know that hepatitis B can be prevented when workers are immunized against it. So 95% of this 37% of hepatitis B infection can be prevented with a basic schedule of immunization, which are 3 doses of hepatitis B vaccine. And we cannot calculate fully the effects of accidents, occupational hazards, accidents, deaths, and injuries on the workers, their families, and largely to the institution like the hospital or the Ministry of Health, for that matter. So all these points really show us that there's a lot that needs to be done to reduce the risk of hazards occurring at our workplaces. And that's, when that is done, we will be able to reduce these high numbers, at least so that we can prevent occupational safety diseases from occurring. So basically the aim of occupational safety and health, or occupational health and safety, it doesn't matter, you can use the terms interchangeably, is to promote and maintain the highest degree of physical, mental, and social well-being of all workers. And secondly is to prevent unfavorable effects of health that are caused by the working condition. Like in a hospital setting, you'll find the hospital-acquired infections, which are common. And if we prevent them, then we deal with the effects of health caused by that environment. To also become familiar to occupational environment of physical and mental needs of workers. So occupational safety and health, there are principles that underpin it. And one of it is rights of workers. So workers have rights in that employers must provide a safe working condition for employers to work in. And secondly is policies must be established. So policies both at national level have been set. This is done by the DOSH, which is Directorate of Occupational Safety and Health Services, in conjunction with the Ministry of Health. And coming down at KNH, the division has also come up with a policy of occupational safety and health. And this must be effectively communicated to all workers. There must be a national system. There also needs to be a national program that must be formulated. And once formulated, it must be implemented, monitored, so that you can see if the preventive mechanism in place are effective or not. There's also a consultation with all stakeholders. This includes the management, the staff, in a hospital setting. So it's the management, the staff, the visitors. I mean, all stakeholders must be involved in coming up with the policies and systems that you put in place for OSHA. The programs and the policies must aim at prevention, and protection. So all the efforts should primarily be addressed in preventing hazards at workplace. There's also continuous improvement. So this is whereby you kind of review the regulations, the policies, the SOPs that have been put in place to kind of improve on those policies. There's also an issue of information. So information collected should be disseminated. This information can be concerning the hazards, the hazardous materials that are found. There is also need to do surveillance, and that information should also be communicated. There is also need to kind of disseminate information that you get from monitoring when you conduct OSHA inspections for compliance. And this is basically to establish and enforce and kind of see the effectiveness of the policies. There's also promotion of central elements, health promotion, which is basically deals with matters of sensitizations, health educations, to enhance workers' health, mental and social well-being. There's also compensation, rehabilitation, curative services that should be availed to all workers in case of an injury, in case of an accident, or any work-related disease. There's also responsibilities and duties. Workers have their responsibility to ensure that the procedures set in place are followed. Employers also have the responsibility of providing a safe workplace for the workers and the patients and the visitors. And the management also has the responsibility of coming up with the policies and the regulations surrounding occupational safety and health. And lastly, as I said, is policies to be enforced through inspections to monitor compliance. So everybody basically is required to participate in occupational safety and health, from the top management down to the list of workers in any setting. This is basically to ensure that everybody is in tandem with what occupational safety and health is all about, and the safety practices that have been adopted or that have been proposed are adhered to. Employers are the best people to kind of push occupational safety and health issues in our workplace, and this is because they have the greatest degree of control over their workplace. For instance, when you enter into an office, you are the one who occupies it. So you will want to know what hazard you might be exposed to. And when you know, the degree of kind of preventing the hazard from occurring raises up, so that you involve other stakeholders to kind of deal with that hazard, so that your health, your workspace can be safe and healthy. So I'll go into categories of hazards, which are basically two: a health hazard and a safety hazard. So a health hazard is any agent or condition or situation that can cause an occupational illness. And it can be serious and immediate, which is acute, that has acute effects, or long-term, which can cause chronic problems. Basically, the health hazards are divided into the categories that you can see, starting with chemical hazards. So anything that touches on chemicals in your workplace is categorized under chemical hazard. These can be solvents, drugs, disinfectants, cleaning disinfectants such as sodium hypochlorite, phenolics. There's also formaldehyde. There are different types of chemical hazards. There's also biological hazards, which emanate from bacteria, exposure to bacteria, exposure to viruses, which can be categorized either in bloodborne infection, airborne, or body fluid pathogens. There's also physical hazards, such as heat, light, vibration, noise, and radiation. There's the mechanical hazards. These emanate from systems and processes, such as boilers, air receivers, lifts and lifting equipment, machine in motions, so on and so forth. There's also the ergonomic hazards. This basically entails the work design, like the furnitures, what seat you sit on, the table that you use, how you sit on that seat. A lot goes on ergonomic hazards. And lastly, on specific stressors, such as harassment, violence at workplace, the different shifts, day, night, harassment from patients, and harassment from visitors. So basically, this is just to show you the breakdown of the different categories of occupational hazard. As you can see, there's the physical, chemical, biological, mechanical, and psychosocial. And lastly, that is not included here, is the specific stresses. So that was basically the first component of the hazard. So this is the safety hazard, which is anything that can cause an injury, a cut or a fracture. So safety hazards can cause harm when workplace controls are not adequate. Examples of safety hazards include sleeping, probably when the support staff are washing and there is no sign stating that there is cleaning in progress. Somebody can sleep. Fire and explosion hazards. And that is why emergency exits come in handy. There's also moving parts of machinery, tools, and equipment. There's working at height. If you can walk through Kenyatta, you'll see that there's a lot of constructions and people are working from heights. They're actually supposed to kind of use PPEs and safety gears to protect themselves. There's also ejection of materials, such maybe when there are kind of digging, pressure systems such as steam boilers, forklifts and trucks, lifting and other handling operations, unsafe use of explosives, workplace violence, and hazards posed by working alone or in an isolated workplace. So this diagram basically is to show you the types of hazards that can present themselves in the hospital and the route of exposure, maybe physical, through physical contact, through inhalation, contact with skin, ingestion, or interactive. And these are some of the health outcomes: accidents, absenteeism from work, pain, distress. When somebody is exposed to asbestos, there can be asbestosis, and psychosocial health conditions such as violence, as we had discussed before. And the ultimate adverse effects on the economy is loss or decreased gross domestic product, decreased productivity at work, at home, loss of family income, and loss due to closure of business. So after knowing about the hazards, you'll want to know how to identify them. So below are some of the methods that you can use to identify hazards at workplace. So there's workplace inspection. So this is done by a team of around 3 or 4 people, depending on your institution. So you select a team, or rather a team is put in place to conduct the workplace inspection. There's also use of material safety data sheets, most likely in the laboratories. When chemicals come in the hospital, you'll want to see the material safety data sheets. Complaints and investigations. When staff complain of injuries, you'll want to investigate and find out the cause of the injuries or the cause of the accidents at workplace. Also, there's also the hygiene survey and medical examination. I'll also share about the occupational diseases that can be as a result of exposure to the hazards we have just seen. There are lung disease, respiratory diseases, such as silicosis. This is due to exposure of silica. It mostly happens in mining, also asbestosis. There's also occupational asthma. When there is too much overcrowding in a room, it can lead to occupational asthma. There's also skin diseases such as occupational dermatitis, sunburn and skin cancer, and other diseases such as the carpal tunnel syndrome, which can be caused with long use of computers, like typing, when you type for long periods of time. There's also the computer vision syndrome. This is whereby you stare at your computer while working for long without breaks. There's also lead poisoning or occupational hearing loss. So all the hazards can be prevented and controlled through following the hierarchy as shown. So start with the most effective one, which is elimination. So elimination is whereby you deal away completely with using a substance or a chemical that causes a hazard, and you kind of use another one, a lesser or an alternative material or substance. So this will physically remove the hazard. There's also substitution. So you replace the hazard or the substance that causes the hazard with at least one. Like instead of using chemical solvent, you'll want to probably use water-based solvent. There's also the engineering controls. This is whereby you kind of balance your work shift so that you don't overwork people. You also isolate people from the hazard. Like in the engineering departments, the machine that they use, you put barriers to prevent them from exposure to those machines. There's also the administrative aspect. You change the way people work. And lastly, which is the list of the hierarchy of control, is use of PPEs to protect workers. And lastly, for this presentation, we'll talk about occupational safety and health legislation. So health, as we know, is basically underpinned in the Constitution of 2010, Article 43. The Constitution says that we need to have the highest attainable level of health. There's also the Occupational Safety and Health Act, and there is also the Work Injury and Benefit Act of 2007. So some of the components of Occupational Safety and Health Act 2007 is to display and keep documents as required by the Act. So basically, this is whereby the institution is supposed to display the registration of the registration of workplace. So this is a document whereby the DOSH, Directorate of Occupational Safety and Health Services, issues when you take the license. So you're supposed to display that register. The Act also stipulates that we need to report on accidents and dangerous occurrences and occupational diseases in Section 21. There's also reporting of occupational diseases by registered medical practitioners as underpinned in the Act. There's also establishment of health and safety committees in the institution, having specific functions and duties as underlined, like establishing a schedule of inspection every financial year, conducting the inspections at least within 3 months, that is a quarter, inspecting, investigating, and making recommendations of all the hazards and how you can probably deal with the hazards, identifying occupational hazards and cases of ill health among workers at workplace, compiling the statistics of accidents, dangerous occurrences, and ill health as primary data. We also investigate complaints related to workers' health, safety, and welfare, and advise on adequacy or otherwise safety and health measures for a particular hazardous material or activity. You can also establish effective communication channels on matters of health within the organization between the management and the workers. You also organize contests or activity necessary for achieving the fulfillment of the mandate of the committee. And lastly, you can conduct seminars and workers' education programs and provide information for safety, health, and workers' welfare, as I'd said before. So in summary, basically all hazards must be controlled to minimize the hazards leading to occupational safety, occupational diseases at workplace, and also all of us to just keep our workplace safe and healthy. That is my short presentation, and I'll take in questions from any of the participants. Thank you.
We'll be able to
Thank
get
you,
supplies
Mr. Wakaba.
of the product, the original product.
Sorry?
Sorry, thank you very much for your presentation. We truly appreciate that you're very elaborate and clear in your presentation. Asante sana. Before we go to the Q&A section, I'd like to ask the participants, what safety measures has your facility put in place to keep you safe? And I'm talking about safety measures in all the areas in your facility, be it in the clinical area, be it in the kitchen, be it in the farewell home, be it even in the offices, what safety measures has your facility put in place to protect you? Are there any policies that your facility has developed? Kindly let us know in the Q&A section so that we can be able to see what others are doing well out there and we can borrow from them. And also let us know which facility, as you comment on that, let us know which facility you're coming from. So thank you for that. About the CPD points, allow me to address that towards the end of the session. Yeah, allow me to address that. All the people asking about CPD points. So Mr. Wakaba, there's a question from somebody who's asking that you elaborate on the compensation process when an employee is hurt at work, when an injury occurs at work. How can an employee go about getting compensated for that? And are there laws for that?
Yes, yes. So one of the legislation that I shared was on WIBA, which is WIBA is Workplace Injury and Benefit Act. So under the act, it stipulates and kind of elaborates on ways in which an employee can be compensated in case of an injury, a workplace injury. So basically what happens is that once an institution sets up occupational safety and health system, there'll be committees in place. Like in our case, there's the hospital-wide OSHE committee in place. So what that means is that when such a case is reported, the committee will do its due diligence in conjunction with the human resource department. So the worker is supposed to report the incidents or the injury to the committee. The committee is supposed to make a recommendation to the human resource management. And also the human resource management is supposed to forward the report to DOSH, which is Directorate of Occupational Safety and Health Services in Kenya. As they are doing that also, there needs to be an assessment by a registered physician or doctor by DOSH who will assess the worker. And if it's found that the disease is occupational, like it happened as the worker was working, then that report will be forwarded also to the Directorate of Occupational Safety and Health. So having done that, later on, after they have already analyzed the reports, that is the HR of the institution and DOSH, then it will be able now to kind of come out clearly that this is a disease that was caused, or rather this is a workplace, is an occupational disease, and this said worker is supposed to be compensated this much. So basically that is kind of a preview, or rather a summary of what should happen in case of a compensation.
Thank you, Mr. Wakaba. And we're talking about physical injury.
Yes.
But in some cases, especially in healthcare, you'll find that the abuse might not just only be physical, especially if you're dealing with a violent patient or if you're dealing with a patient who has psychiatric issues.
Yes.
You might find even verbal abuse goes to that extent. And even sometimes with the relatives. I don't know how many participants here probably have had they've had an interaction or they've had a confrontation with relatives, and it has led to a verbal exchange of words where the staff has been abused by. Can we claim that, or that cannot be quantified? Where injury has occurred, it is not physical, but there was a confrontation and there was an exchange of words, maybe due to anger, due to reasons beyond the healthcare workers' knowledge or scope. But the relatives probably were agitated at that time, and that happened. So are we able to also get from an occupational safety point, can somebody actually claim compensation for that abuse?
Dr. as you have said, it will be very difficult to quantify the abuse, but it's possible. What DOSH has done, it has registered a number of doctors who can do the assessments. So if a doctor can kind of quantify the extent of the mental effects, like the verbal abuse on the said staff, and make a recommendation that the staff should be compensated, then it's possible. But if the doctor fails to assess, then it won't be possible.
Okay, thank you. Thank you for that. Although I believe that would be very hard to quantify and assess and even write a report about it.
Yes, yes.
Yes, and this takes me to Francis's comment. Francis was saying that he didn't know harassment was part of an hazard. And thank you for the information. Could you expound more about what are the bare minimum policies institutions should have with regards to harassment? You talked about harassment being one of the key stressors that we have. So
Yes,
to prevent it, because you give us the very nice triangle, and I believe that should be one of the things that we should eliminate. Is it eliminate or administrative control? Change the way people work?
People work, yes, yes.
Yes, so what policies should facilities put in place to protect their staff?
So basically, you can underpin that in occupational safety and health policy, the general occupational health and safety policy in any institution. So we want to capture harassment as part of the policy and kind of just encourage against it, encourage people against such harassment, practicing such things at workplace.
Okay, thank you for that. So just the general policies and maybe sexual harassment or just an harassment policy to protect the healthcare worker or the staff working in that environment. And even that policy also protects the patients because it probably will stipulate and cover them also. So thank you for that.
Yes.
You know, there's another question still about compensation. And somebody's saying for us who have a list of do's and don'ts, for example, you're not allowed to go into the laboratory with open shoes. No one is allowed to handle it. Oh, sorry, those are the measures some facilities have put in place. Thank you, Boniface, for this. You're saying that you're not allowed to go into the lab with open shoes. No one is allowed to handle any chemical or drugs without gloves. Thank you, Boniface, for that comment. Somebody else said that in their facility, the measures that they've put is that there's immunization for all healthcare workers with the hepatitis B vaccine. And I've seen a question from Jabet who's asking, is hepatitis B vaccine given once? Jabet, hepatitis B vaccine, there are 3 doses, which you're supposed to finish them. So were you asking whether you get it once in your life? Kindly clarify your question, what you meant. Did you mean whether you're given once and it covers you for a lifetime, or kindly clarify that question so that we can be able to answer you and give you feedback on that. There's a question from Joseph and he's asking, is there a threshold of injury for one to get compensation? Still in the same breath, somebody's saying, Jonathan is saying, let's say that a health worker gets an injury while at duty. Is the facility where he or she is working responsible for the same?
Okay, so Doctor, can you repeat the questions kindly?
Somebody's asking, if I get injured today at the facility where I'm working in, is the facility responsible for that? And is there a threshold of injury for one to get compensation? Are there compensations which are maybe too mild? The WIBA Act might not cover, the WIBA might not cover.
So basically, WIBA elaborates further on the compensation and what entails, like the thresholds that can be met for one to be compensated. So any form of injury that you get at workplace, as long as there's an assessment, there's a report to that effect, and a doctor assesses and proves that indeed this is an injury or this is an accident that occurred, and these are the injuries that arose from the accident, and quantify the injury, like let's say it's mild or it's severe, then you can get compensation when you follow the due process elaborated in the WIBA Act. And to answer the other question is that, yes, institutions are supposed to be responsible for workers, and this means that even in case of an injury, the institution is supposed to take care of the compensation of the said injury according to the WIBA Act.
Thank you. Thank you, Mr. Yes, thank you, Mr. Wakaba, for that. Sirma, I've seen whether you're asking whether it's given once in a lifetime. Hepatitis B, according to the statistics, they said it's given once in a lifetime, but in case you're in a high-risk environment, you might require a booster. In case you're in a high-risk requirement, or if you're likely to get exposed to infection, you might require a booster 5 years after the initial dose. After the initial 3 doses, you have to complete the first 3 doses. But if you're in a low-risk area, that one-time dose covers you for a lifetime. So for healthcare workers who are in high-risk areas, you might consider, if your facility is offering, it is good to consider getting a booster vaccine for that. Back to Mr. Wakaba, there's a comment from Edwin, and he's saying, a psychiatric patient broke my phone a few months ago. Is there a way I can seek compensation?
I've just seen the question. Well, I don't know how the procedure is in case of an injury, and this is like it happens to somebody, not an item like a phone. So it will be very difficult. I don't know that, Terry.
Okay.
It's somewhat difficult for the compensation to be, yeah.
Yes, I hear you, because most of the compensation that is dealt with in occupational safety and health is towards the individual. Now, when it comes to your property, I don't know whether now what the law says about that.
Yes, yes.
Can you sue a patient under your care? Those are things we'll need to clarify in the medical legal symposium. So we need to clarify that. And sorry about the echo. We'll need to clarify that and find out, Edwin, we'll clarify for you and find out whether you can actually sue a patient who's destroyed your property. So there's a comment from Rose, a question from Rose, and she's saying, when does a staff get full compensation according to WIBA? We have some cases where staff get paid nothing to him or her unless he or she has had permanent disability. Should that be the case? Still in the same breath, somebody is asking, in the case of compensation, who is to compensate, the employer or DOSH? And how does the process go about?
So for the last question, I've answered. The process of compensation is done through your institution OSHE committee, which is Occupational Safety and Health Committee, in liaison with the Human Resource Department and DOSH. So if it follows the due channel, then the worker will be compensated. The other question, yes, staff are supposed to, in case of a compensation claim, they are supposed to get the full compensation. But as I said, this is really underpinned by the assessment that the doctor will do. If the doctor assesses and finds that your injury, maybe after treatment, you'll get better, you'll go back to, you'll be healthy again to continue with your work, then the compensation wouldn't be the same as a person who has a permanent disability. And in cases of permanent disability, they are supposed actually to be paid also. I hope I've answered the question.
Yes, I believe you have. Rose, if the Act says clearly, as Mr. Wakaba said, that you're supposed to get compensated if you get injured. And if there's permanent disability, Mr. Wakaba has also repeated again that you're supposed to get compensated for that.
Dr. Maybe to elaborate further.
Yes.
The only challenge that, or one of the challenges that leads to people not being compensated is like a systemic challenge. So people don't report on the injuries or the accidents, and yet later on they come to claim that they were injured like 3 or 4 years ago, and they claim compensation. So people need to know that, staff need to know that in case of an injury, they need to report it immediately so that the due process can start, of which sometimes can be long and tedious, but at the end of it all, the worker is supposed to get compensated.
That's true.
Yeah.
That's true. Thank you. Thank you for that. From Francis, is saying healthcare workers can be heard by management if they are harassed. What about the patients or clients, especially in private hospitals where they tend to hide their issues? Yes.
Maybe I can shed more light on that. I think this is where the Directorate of Occupational Safety and Health services come into play. When a patient gets harassed in a hospital, he or she is supposed to report it. A private hospital, he or she is supposed to report it to DOSH. So I think it's a matter of us knowing more about DOSH and what it does, their mandate, and basically what they do. So in case of a harassment at a private facility, the patients or the relatives can be able to follow it up with DOSH.
So DOSH also handles patient complaints.
Any complaint, actually.
Any complaint.
Yes.
Oh wow. Okay. That's good to know. There's somebody, Joshua is asking about, is there compensation for a healthcare worker for being clobbered by a patient or a patient relative?
Yes, as I've said, after assessment, if the doctor sees that this injury is severe and recommends for compensation, then that will be done. But also, if the doctor assesses that it's something that you can be treated off and then you get better, the treatment, like the hospital, if you work in a hospital and you get that treatment for free, then I think the discussions will be on another level of how much the hospital will be able to kind of say they used to treat that particular injury vis-a-vis the compensation.
Okay, and somebody is asking whether overworking and underpayment is a health hazard to a professional. Is that part of the list of the hazards that you'd put up? Maybe you could take us back to the list. Overworking is.
Yes, overworking
underpayment,
is.
I'm not very sure. Maybe you can take us back to the list that you'd projected so that we can have.
Okay, let me just share.
Those are the types of hazards, which had long working hours, unstable shifts, irregular work shifts.
Let me just find it, actually.
Okay.
Okay, let me just share.
Okay.
But for underpayment, it is more of an HR component. Yes. So let me try and share.
So a Sila Zephania overworking is working long working hours is a hazard, as had been Mr. Wakaba said before. But about the payment, that might not be a hazard. It might be an HR component that you might need to discuss. Yes, that one. So there's the harassment, violence, shift work. There's also the red table that you'd clearly put up the table. Yes, down there, the psychosocial hazards.
Yeah.
Yes, so I hope the participant has gotten their response. That the psychosocial hazards that are listed down are humiliation, verbal abuse, sexual harassment or abuse, job demands, fatigue, long working hours, unstable shifts, and irregular working shifts. So those are the psychosocial hazards. Okay, now there's a question about composition of a safety committee and what is the criteria of selection for those who qualify. If a hospital or if a facility wants to start a safety committee after this conversation, who should constitute, who should be member of that committee, and how do they go about, maybe if there's any training that is offered that they may be interested in or aware of.
So basically, the composition of the committee, like at Kenyatta here, is as follows. There is a representation from management, including HR, administration. Basically, it cuts across Daktari, if I might say. One member from each department. And then now, here at the hospital, the secretariat is hosted by public health. So composition cuts across HR, admin, finance, nursing, maintenance. It cuts across Daktari.
Okay.
Yes.
So, yes. So, person who asked, it's multidisciplinary. If you're to,
yes,
if you're to have a committee, an occupational safety and health committee in your facility, please make sure it's multidisciplinary, and should be people who at least have some form of training in occupational safety. If they don't have, then you can suggest that they get trained in your training projections. If you do have access to training budgets, that might be good for them to get the training. Now, there's somebody is asking, how can a health worker be compensated for work-related injury, like back injury, where he or she was never assessed before she started working? And this is very common, especially in facilities where they don't have ergonomics is not being practiced. So you find that you're lifting a patient, a bedridden patient, you have to lift the patient to change or roll them over when you're trying to change their linen, when you're trying to nurse them or wash them, you have to lift the patient. So how do we compensate our colleagues who sustain back injuries or back pain? Back pain is very common, especially in our nursing colleagues. Is it something that is compensated by OSHA, or do they have to go through the tedious process proving that they didn't? In other words, how do you compensate it?
So as I've explained before, the process is the same regardless of the injury. But the only factor that we want to kind of look into is if the staff, when the staff was employed, did he or she have that particular problem? That is something that would be assessed and would play an important role in determining the compensation of the said injury. So in the case that the staff came in with a problem, then that is another discussion. But in the case that the staff developed the back pain problem as he or she works, then the staff is liable for compensation. Daktari?
Yes, thank you. Thank you for that. And I hope person who's using ICU PC, you've been answered. Jabet Sirma, yes, your question still is related to what has just been responded to. You're asking about a healthcare worker who suffered sciatic nerve damage after being injected. Yes, they can still get compensated for that. So, Mr. Joseph Wakaba, thank you for your time. But before I let you go, you can see we are coming to the end of our session. Before I let you go, I'd like to just ask a few questions about what you can, you gave us very nice statistics, hepatitis B, infections worldwide, needle stick injuries, which are very common, especially the needle stick injuries are very common in our country or in healthcare.
Yes, in healthcare.
So how do we capture this data to help improve or for safety measures? Do we have special registers and are we able to report to the ministry? The data that you capture, are you able to report it to the ministry to make better decisions?
Yes, Daktari, that is so, but we also have a challenge whereby when staff get pricked, some of them don't report. So if they don't report, then that one case or those 5 cases will not be captured, and that will lead to underreporting. But there's a register. There's a register whereby you record the injuries, the accidents, and periodically we analyze, like in quarterly basis, we do analysis of the accidents, the injuries that happen, and we submit the data. So in the case of underreporting, then we won't have like a clear picture of the needle prick injuries. So even the data that we are using, I can say is an estimate of sorts, but it doesn't like kind of is data that has been taken, but not holistically.
Okay.
Yes.
All right. And I also wanted to ask another question about mental issues in healthcare workers. If a staff has a mental problem and God forbid they jump off the building or they commit suicide, does WIBA cover that? Does the Work Injury Benefit Act, does it cover that? Or mental health issues are not captured clearly in that assessment?
Yes, it is. But Dr. as you are aware, even the president had to intervene in terms of regulations concerning mental health issues in Kenya. So mental health issues in Kenya has been, there's been a gap on mental health issues in Kenya. So as we go by, I think it will be more clearer in terms of if somebody commits suicide due to mental issues from workplace, if they can get, the family can get compensated.
Okay, thank you.
Yes, welcome.
Thank you for that. And final question, this is from Jonathan. He's saying, can the compensation be transferred to the family of a health worker if the health worker gets an injury and dies in the place of work? So does your family get compensated? God forbid something happens and you die while at the workplace. You get maybe electrocuted by a machine that you're operating, or something just happens, God forbid. Can the family get compensated?
Yes, it's possible, but the family will need to initiate the process by probably engaging the management, the hospital management, to get that compensation.
Okay.
Yes.
Thank you for that. And just before I let you go and address issues of CPD, I'd like you to just go back to your last slide, the one for prevention and control, so that we can leave it as a take-home point for the participants.
Okay.
The hierarchy of controls.
I'm just sharing it now. There it is.
Thank you. And I just wanted to highlight to the participants that most of us are at the PPE stage in our facilities. And even the PPE has been an issue and has always been an issue. So if you look at the bar that is on the side, that is the least effective method, protecting the health worker with a PPE. Today you've attended this session, and I hope you've picked something about how to protect yourself in your facility, how to make your facility a more safe and conducive work environment for yourself, because that is the aim of occupational safety. Make the environment to be safe and conducive for you to work in it. So these are some of the things that you can work on as a facility, as an individual in your area of work, or it's a conversation that you can start at your place of work. So the PPE, as we've been told, is the least effective, but there are other things that you can put in place, and the most effective is eliminating the hazard. So if you can put in safety measures to protect you, to protect the patient, to protect your colleague, then you will have gotten to the highest level and the most effective method, where you physically remove the hazard. And I'll take an example. Mr. Wakaba gave a good example about slipping and falling down. And I don't know how many of our facilities have even the yellow sign. Sorry,
Signage.
Mr. Wakaba, signage.
Yes.
Just signage to show that there is a patient has vomited here, or this is a wet area, or we are cleaning this floor. And unfortunately, some of the facilities that are currently being built, you'll go there and you'll find the floor, it's a tile floor. It's not a non-slip type of floor. So even just the way we do our current constructions and buildings, let's make them to be safe for us who are working in those facilities, and also for the patient who's coming to the facility. Mr. Wakaba, would you like to add anything? Maybe your last remarks as we end this session?
So I'm grateful for the opportunity to present, and I'll share the presentation with you and with the research team, so that you can disseminate it to the participants. Thank you.
Thank you very much. And thank you for your time. Thank you for honoring the invite. We appreciate you and the rest of the public health team for the great work that you do. Asante sana.
Asante pia daktari. Thank you.
Okay. Now, seen a few questions. Before we end our sessions, let me address the issues of CPD from the members. So I'm seeing a few questions about CPD. And for our colleagues from members of PPB, I've just got a message that is saying those who are asking about CPD for last week or recently to wait, because the attendance lists are being sorted. And the sorting is done on a weekly basis. Remember yesterday, Dr. Iwak took us through the process of how they do that. So they're working on them, and they're also working on the past events as well. So if you never got your CPDs from the past, they're also working on that. And that will take a bit of time, but rest assured you'll get all your points. Also from members of the PPB, there are only 2 to 3 events per week from the schedule that will be uploaded on the PPB portal. So the process for getting your CPD points, if you're a member of PPB, you have to subscribe through the portal, the PPB portal. So if the session is not there and you attend, there'll be challenges giving you CPD points or awarding you CPD points for that session. And we'd like to request you to just follow through that, because that is the guidelines that were given. And we hope the process will be much better and streamlined for you. So we really hope very soon, all the people are saying in the last 3 weeks, in the last 1 week, somebody's saying I've attended at almost 20 sessions and they've never received any CPD points. Also, I'd like to request you, as you put some of the comments, let us know which cadre, so that we know where we're having a challenge, because when it's a blanket one, we're not able to know whether it's from the Pharmacy and Poisons Board or it's from the Medical Council that you're having a challenge. And some of these issues you can be able to address with Dr. Online. We're currently managing our CPD issuance program. For the nursing team, as we were told yesterday by Ms. Rose Njoroge, she's following up on getting the token system from Nursing Council of Kenya. Remember, most of our regulatory bodies had a booklet that had to be signed. So now we are going to a system of getting the token and getting facilities accredited to be under the regulatory body system. So that is the process, that is the conversation we're having with your regulatory bodies, the Clinical Officer Councils of Kenya, Nursing Council of Kenya, Physiotherapy Association of Kenya, so that we can be able to see whether they can also be IT compliant to make it easy for us to give you CPD points. Where they're not able to, we're requesting you, if possible, to bring your booklet. We will gladly sign it for you, the sessions you've attended. So for our nursing colleagues who are due to renew their licenses, before we get that token system, you can bring your booklet, we will sign for you, and you'll be able to get your CPD points. For our team members from the Clinical Officer Council, I know we are almost renewing our licenses. We're in this process of renewing our licenses. So as the conversation still continues, if there's a way in which you can facilitate and alert your body that you attended this session, kindly let us know. Let us know how best to help you, Moses. Let us know how we can be able to get that, because the token system are usually generated by your body and they're different. For the medical council, they're different, medical and dentist council, compared to the ones for PPB. The numbers are totally different. So if we give you a number for the medical and the dentist practitioners council, you'll not be able to use it in the Clinical Officers Council. You'll not be able to use it in the Nursing Council of Kenya. Every body issues their own different system. But we hope for the day where we get a constant system where everybody's using the same system, and we can be able to allocate all of you your tokens, and you won't have issues with your bodies, with the regulatory bodies. But in the meantime, we still have to sort that issue with them. But we hope you'll be able to get all your points. There's somebody who was asking, Beatrice, you asked about your workmate. Now, unfortunately, due to the limited clinical history and our inability to do a physical examination on your workmate, we're unable to tell you what the problem might be with your colleague. But I'd like to urge you to kindly take her back to hospital or request her to go back to hospital and get checked. So we're unable to answer and give you a response, Beatrice, but thank you for your question. There's a comment about somebody who's received half of the tokens and they're always invalid or expired after redeeming them. Yet I put them at the corresponding topic and date. One thing that was clearly explained yesterday, if the session is not in the PPB portal and you've subscribed to it, you've attended it, you didn't subscribe to it in the PPB portal, but you've attended it, then that token is registered as invalid or expired once you try to log it into the PPB system. So follow the process that has been laid out by PPB. Subscribe to the ones that are on the portal for your tokens to be valid. For the ones who have expired or invalid tokens, and unfortunately we don't know how we can help you, but if you can be able to talk to, there's a gentleman whose number was here, can you be able to talk to them, then it might be good for them to be able to issue you, to streamline the process at the PPB end. Maybe they may be able to accept if you can be able to show that you attended the session. Joel, you're saying the KNH meetings are not on the PPB portal? Yes, there are very few there. I think they put 2 to 3 events per week. We'll follow up whether they can be able to put more on the portal, but that is what the team is able to do at the moment. Deborah is saying on CPD, some of the events can't be seen on the portal to claim them. Are you backdating the sessions? Because I've received CPD mails from May, but can't find the sessions on my platform. When I subscribed previously, must I keep subscribing for each event? I'm not sure, Deborah. Maybe you can consult the team at PPB to clarify more about how their portal works and whether you can claim tokens for a session that you attended previously, and now it's when you received the points, because we're still issuing points for sessions you attended previously. Remember, we had a bit of a delay around May, June, July. So we are still going through that register to issue you tokens for that. But we'll need more clarification whether that token will still be valid or you'll have challenges logging it in. Somebody should say, I wanted to ask whether if the KNH webinar should be included for easy subscription. Yes, they're included, but let us know how we can be able to streamline that and make them better. Cynthia Nyanchoti, yes, I've seen your question, but your device is reading as Oppo A3s. Now, this is one of the challenges we've been having, whereby the register that we have reads your device name. Now, when it comes to the team that is cleaning up the data, they're not able to know this is Cynthia who logged in. So our kind request is please log in with your name. If it's your device name, you can change it to your name, because once we see the device, we don't know. There are many people who own Oppo A3s. So that is how you might not be able to get some of these points. Alternatively, if you log in using somebody else's name, it will be difficult to get, or somebody else's account, it will be difficult to get the points because you're using another person's account on that day. Also, how can someone be registered on this? Sylvia, you're asking if this is the event is the same as medication safety. Medication safety happened yesterday, and all of this week we'll be having conversations regarding patient and staff safety. So I believe it is the same, but allow me to confirm. Allow me to confirm and communicate with you tomorrow whether it is the same thing or that is a different session. Ranjoy, maybe you can write to us so that we can know what happened. But I hope you've been logging in using your name and a token. Somebody says, I've never gotten any email on token numbers for the CPD. For those who have not received emails regarding your sessions, but you've attended the session and you've attended within the time frame that is stipulated in the PPB regulations or rules, please write to us and let us know how we can assist you. And also check your spam mail. Some of them might have come to your spam mail. And I hope the email accounts that you gave us were valid, because that is the email system that we're using. So if they are valid, then you should be able to get your points. Phantom 6, if you're logging in with a device and we're using the device name, we will have a challenge knowing who Phantom 6 is. And that is how we're having challenges with some of our participants because of the device, they're using their device name. So Phantom 6, we apologize that you've not received any CPD points, but kindly let us know who you are and also change the name so that it just reflects your name for the sessions that you attend. Somebody saying, when I subscribe, it tells me I already subscribed. That is why I asked that. Deborah, let me clarify that with the team from PPB and then we'll let you know. Let me clarify that. Robert, you're saying in the hierarchy of control and prevention, you didn't understand elimination and substitution. I don't know whether Wakaba is still here. Has it dropped off? Yes. Oh, hello, Mr. Wakaba. Hello. Okay, I'll attempt, Robert, to talk about elimination and substitution. I think we've addressed all the CPD issues. Yes, I think I've addressed all the CPD issues. So let me address that last question from Robert. And we've confirmed about CPD. One last comment about CPD before we go to Robert's question. And somebody saying, Nilesh is saying, for example, is this session and that of yesterday on the PPB portal? For yesterday, it was, but for today, I'm not sure. I don't have access to the PPB portal, so I'm not sure whether it was put up or not. And it's saying I can see a KNH webinar on medication safety for this week on the PPB portal. So is this the same as the titles does not match? I will find out. And maybe if the details on the time is clearly displayed PPB portal on the details, so we can know if we're attending the correct CPD session for PPB points. Thank you for that feedback, Nilesh. We will find out how your portal looks like and see how to streamline it. The team at PPB is the one that puts up this on the portal, so we'll find out how that works. And also the timing and the clear details to be put in place. But thank you for that feedback. Okay. So Robert, you asked about in the hierarchy of control. You didn't understand between elimination and substitution. So in that hierarchy of control, we talked about elimination being the most effective method. And there, Mr. Wakaba said that is physically removing the hazard. I'll give you an example of elimination from my understanding. So for example, we have, let me not use a door, but I want to use the structure. I want to use a building structure. So assuming we have a floor that you're making for the hospital, this is theater, you're constructing in theater, you're constructing even in the ward. And the floor that was put there by the people, by the team that was building the first time is a slip, you can easily slip and fall down. Or you'll find that, no, that's a bad example. Physically remove the hazard. To eliminate is if there's something that is a barrier that is making you not be able to access the fire engine or the fire escape route. There's a door that is blocked, that is closed, and that is your fire exit. Then that is one of the ways that you can physically remove that barrier and create an exit for you and your team to be able to pass through that door. The second one is you asked about substitution, where we are replacing the hazard. This one I might need the team from OSHA to clarify more about that, about substitution. So maybe in Mr. Wakaba, if he's still here with us, you can clarify about substitution, where we are replacing the hazard that is likely to occur. We're not physically removing it. We seem to have, Mr. Wakaba seems to have dropped off.
Actually, I'm back, sorry.
Yes. Karibu. So Robert was asking about the difference between elimination and substitution.
Okay. So substitution is basically completely using a different either chemical, like you said, instead of using a substance that poses a risk to an hazard, then you completely change and use another substance that doesn't pose that risk. And then substitution is basically you still use the same substance, but which is less risky in terms of presenting a hazard.
Okay, any examples to that?
So as I said, like for the solvents, you'd want to use a water-based solvent, which is less risky than the other types of solvents. Or for us, instead of, how can I put it, Dr. Okay, let me just find something and then I explain better.
Okay, so as Mr. Wakaba does that, Samuel Mwenda, you're saying you're a biomedical engineer and you wanted to know how much your points are. Samuel, I don't know how much your points are. Is there a system of you reclaiming your points? that your organization, you're saying you're EBK registered? So is there a way in which you can find out from your regulatory body how to be able to reclaim your CPD points? But I don't know how much your points are. Richard, different regulatory bodies have different amounts of CPD points being awarded weekly. So for the PPB, they have their own system, or different, you can find it 1 point, 2 points, depending on what they decide. For the medical and dentist practitioners council, you can find it's 3 points, depending on what is decided. Nursing council might find it's different. So I really wouldn't know what your current body has stipulated or said will be the CPD points for a session, a webinar session like this one. Okay, Mr. Wakaba, before we end the session.
Sorry for muting.
Yes.
But basically, substitution is you replace, instead of like for the engineering sector, like area in our department, instead of using maybe a machine that basically exposes a worker to a hazard, then you substitute it by either, if it's timber, you buy the timber. So that is substitution. And then elimination, elimination is you choose a less risky chemical over the one that is presents a more risk of sort. Dr.
Okay, thank you for that clarification, Mr. Wakaba. So I think we've addressed all your CPD concerns. I think we've discussed most of them. Anyambura, you're saying you've sent emails like thrice now, but there's no response. Anyambura, yesterday we just got a brief explanation of what happens. So what happens is we still have our day-to-day jobs that the team does, and the part of the obligations that the hospital requires us to meet. And then now we have the webinar sessions. So you'll find that most of your emails will be responded to later. Now, the amount of emails that come, like today's session, we had almost 600 and 700 people. I can imagine if you get even just 100 emails, responding to all of them might not be very easy, not unless you put an automated response system. But you see, we can't put an automated because everybody has a different concern. So bear with us. And I know you've said you've sent 3 emails thrice now, but no response. Bear with us. If your issue is not handled either by you receiving a token system or a token or whatever concern that you had, we will respond to you. But the team that handles the email usually gets quite a lot of workload when it comes to the email. So once they finish their work, then they're able to address your emails. Sometimes it may take a day, 2 or 3, or even a week, depending on the concern. And sometimes the response might come in your issue being addressed without them responding to your email, especially if it's something to do with the CPD. You might find that you'll get your token before they get to respond to your email. But let us know if it's something very urgent that was not responded to. Please write to us again. We'll be able to see your email and address it. But thank you for the communication, and thank you for the feedback. So I'd like to end this session here, and the poster for tomorrow's session is up there. Tomorrow we're going to have an interesting session. We're still having the medical legal symposium going on, and we'll be talking about evidence gathering. This is a very crucial session for us to all understand. As a healthcare worker, how do you gather evidence? When a patient comes to you and you need to take evidence because you might appear in court at one point or the other. How do you get that evidence to be able to protect yourself and also to be able to give justice to the patient. So that is the conversation we'll be having tomorrow with the experts in that area, and we hope you'll be available for that. We'll also issue the sessions for Thursday and Friday, and we'll let you know the timings. So have a good evening, and thank you all for finding time to attend this session. We appreciate, and I hope most of your concerns have been addressed and will be addressed. Bye.